1. An order for bupropion or Wellbutrin has been placed with a client. When is it appropriate for the nurse to give the order? A. On an empty stomach. B. Early in the day. C. Immediately before bed. D. When the patient requests it. Two. A temperature of 101 degrees has been recorded in a patient with acquired immunodeficiency syndrome and pneumocystis jirovecii infection. Pentamidine is administered to the patient or Pentam 300. Which of the following symptoms does a fever indicate? A. Another infection developed as a result of the medication's leukopenic side effects. B. The patient's thermoregulation has become insufficient. C. The drug is causing side effects in the patient. D. The medication's dose is too low. Three. If a client is experiencing dizziness after receiving procainamide or Procandid intravenously, the first nursing action is to A. Obtain a blood pressure reading by auscultating the client's apical pulse. B. Obtain a 12-lead electrocardiogram as soon as possible. C. Administer the nitroglycerin pills as directed. D. Using a rhythm strip, record the heart rate. 4. The therapy in which a client's feelings, attitudes, and behaviors are modified by focusing on the therapist-client relationship is called A. Family therapy. B. Behavior therapy. C. Cognitive therapy. D. Interpersonal psychotherapy. 5. A client with hypokalemia is receiving instruction from the nurse. What kind of diet will the nurse be introducing? A. High potassium diet. B. Cardiac diet. C. Sodium restricted diet. D. Fat restricted diet. 6. Which of the following is the most important assessment for a client receiving bumetanide or Bumex intravenously for acute congestive heart failure? A. Monitoring blood pressure. B. Monitoring weight loss. C. Monitoring urine output. D. Monitoring potassium level. 7. The nurse expects the following laboratory tests to evaluate the therapeutic impact of heparin intravenously given to the client. A. Hematocrit. B. Activated partial thromboplastin time. C. Hemoglobin. D. Prothrombin time. 8. Which one of the following is not a source of acquired immunity? A. Animal serum. B. Antibodies received in response to disease. C. Prescribed multivitamins. D. Antibodies received from the mother. 9. Dextroamphetamine or dexedrine has been prescribed for a 10-year-old child who has been acting out in class. The nurse will tell the parents to do the A. Give the last dose at least 6 hours before going to bed. B. Ensure that the child consumes 6 to 8 glasses of water per day. C. Unless otherwise directed, ensure that dosages are given consistently. D. Make sure to take the prescription after a full meal. A patient has voluntarily checked herself into the hospital's mental health unit. The nurse anticipates the following from the client. A. The patient will be participating in the treatment and care planning. B. The client refuses to be treated. C. The client's family is not going to cooperate. D. The client will be angry and confrontational. Methamphetamine or desoxin was prescribed to an 8-year-old girl who was overly energetic at home. The nurse instructs the parents to do A. Establish that the child eats a low-sodium diet. B. Make sure to take the prescription after a full meal. C. Give the last dose at least 6 hours before going to bed. D. Ensure that the child sleeps for at least 8 hours. An assistance group has been talking with a depressed hospital patient. Which behaviors suggest that the patient is on the verge of committing suicide? A. The patient begins to give away his or her stuff. B. The patient has outbursts of anger. C. The patient expresses his dissatisfaction with the other members of the group to the nurse. D. Because he dislikes the group leader, the patient requests to be placed in another group. An indwelling abdominal catheter is used by a client who is having peritoneal dialysis for chronic renal failure. If the client spills water over the catheter dressing, what should the nurse do? A. Sterilize the catheter with povidone iodine. B. Replace the catheter. C. Reinforce the dressing. D. Change the dressing. What might a nurse anticipate to see after transfusing platelets into a trauma patient who has several cuts? A. Relief of fever and headache. B. Decreased blood flow from cuts. C. Less clammy skin. D. Increase in energy level. A 35-year-old male who has used cocaine is being assessed by an emergency room nurse. What are the signs that the client has overdosed? A. Blank stare and tremors. B. Vomiting and disorientation. C. Myocardial infarction and ataxia. D. Constricted pupils and hypotension. The treatment of which symptom is the expected effect of omeprazole or Prilosec? A. Flatulence. B. Heartburn. C. Constipation. D. Diarrhea. For a client using codeine sulfate, the nurse would specifically include the following in the treatment plan. A. Monitor bowel activity. B. Monitor for hypertension. C. Monitor peripheral pulses. D. Monitor fluid balance. (18) During a softball game, the client was hit by a wild pitch and incurred an eye injury. What is the nurse's initial response? A. Perform visual acuity tests. B. Notify the doctor. C. Immediately apply ice to the affected area. D. Put on an eye patch. (19) On Coumadin, the client had a prothrombin time of 20 seconds and a control time of 11 seconds. According to the nurse, this means A. Results are lower than the needed therapeutic level. B. The results are above the therapeutic range. C. Within the therapeutic range. D. Test needs to be repeated. (20) Which of the following conditions is metoclopramide prescribed for? A. Ulcer disease. B. Chronic bronchitis. C. Vomiting after chemotherapy. D. Tuberculosis. ISPN and CGFNS. The ISPN, or International Standards for Professional Nurses curriculum, is designed for globally trained nurses wanting to validate their nursing education against global standards. It is intended for first-level nurses or nurses who earned local certification and wish to work as professional nurses abroad. Nurses who apply must live in the country to which the program is being offered, or presently China, Indonesia, and South Korea. The ISPN tests the nursing skills of licensed first-level nurses, or RNs, against global standards. The ISPN program comprises two components: 1. An initial verification of first-level, general nurse status, and 2. Passing the CGFNS qualifying exam. The exam includes common clinical fields of CGFNS nursing practice: adult health nursing, nursing of children, psychiatric and mental health nursing, maternal and infant nursing. The CGFNS qualifying examination tests safe and effective nursing care, with an emphasis on nursing services, improvement and maintenance of health, focusing on lifelong growth and development and early detection, prevention, and treatment, health services pertaining to the need for psychosocial integrity, physiological reliability, focusing on the proper functioning of the structure of the body,